What are the possible causes of Vata Kapha dominant disease? How to interpret the Nidana or etiological factors which increase the abnormal increase or abnormal vitiation of Vata and Kapha Dosha. This is the topic of discussion this particular video. Dear ANA community members, press the like button and spread this particular video to maximum number of tutorial learners so that we can make a huge movement to this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching the right information at the right time for the right purpose. When you think about the Nidana of Vata Kapha dominant disease, there is no specific direct reference regarding the Nidana of Vata Kapha dominant disease, but the interpretation has been mentioned that Dvandvantu Sankarat. So that means Dvandva refers to the dual or the two numbers. Whenever there is considered to be the Dvandva dosha, it will be either Vata Pitta, Vata Kapha or Pitta Kapha. So far we have discussed Vata Pitta and Pitta Kapha disorders, its Nidana. In this particular video, we are going to learn about the Vata Kapha dominant Nidana, how that will be responsible for the manifestation of a Vata Kapha dominant diseases. It is being mentioned regarding the Vata Prakopaka Karana in Ashtanga Hridaya, Tiktoshana Kashayalpa Ruksha Pramita Bhojanaihi, Dharanodiranisha Jagaratyucha Bhashanaihi, Kriyatyoga Bhishoka Chinta Vyayama Maithunaihi, Grishmahu Ratri Bhuktante Prakupyanti Samirana. These are the possible Nidana that are being mentioned for Ashtanga, for the Vata Prakopa as per Ashtanga Hridaya. Regarding the Kapha Prakopaka Nidana, Swadvamla Lavana Snigdha, Kurvabhishanti Shitalehi, Asya Swapna Sukhajirna, Diva Swapnati Brahmanehi, Prachardanadyayogena Bhuktamatra Vasantayoho, Urvane, Urvaratre, Shleshma, Prakupyati. This is considered to be the Kapha Prakopaka Nidana. Whenever the person is exposed to the Vata Prakopaka Nidana and Kapha Prakopaka Nidana together, in the sense there may be the possibility of one, two, or more Vata Kapha dominant Nidana, or there may be a possibility of one, two, or more Kapha Prakopaka Nidana. Exposure will be observed simultaneously in an individual. At that particular time, the person will be having the manifestation of a Vata Kapha dominant diseases. So here we are going to learn these with a few examples. Before that, whenever if you are going to analyze the Nidana as such, we need to know about the S and V of pathogens. In the sense, S refers to the source of entry of pathogens among the natural orifices, or what we can say the Bahya Srotas. Which particular Bahya Srotas is having the exposure to these particular Nidana, that has to be known. Then the number of pathogens entering into the body, less number of pathogens refers to the less serious disease, more number of pathogens in the sense more serious form of the disease. Whereas virulence of the pathogens are concerned, less virulent pathogen, less severe form of the disease, more virulent pathogen, more severe form of the disease. As far as source of the entry of pathogens are concerned, one source of entry, less serious disease, more pathogens of the entry into the body, more serious form of the disease. So like that, this has to be analyzed whenever if you are going into the assessment of Nidana as such. Coming to the different examples here, let us say the first example, the consumption of ice cream in the month of January. So that is, when you think about the Vata Kapha Prakopaka Karana here, it could be a Shitakala and it could be Madhura Rasa Sevana. Whenever if you are looking into that particular point, consumption of ice cream, that will be responsible for the increase of the Shita Guna, that too in the alimentary canal. And whenever if you are thinking about the surroundings as such, so that will be responsible for the increase of Shita Guna towards skin and respiratory passages, because the cold air will be entering into the respiratory passages. In that way, the Shita Guna increase will be observed in the respiratory passages also. In that way, we are going to expect the increase of Vata and Kapha Dosha due to the Shita Guna in the skin, alimentary canal and airways. In this way, we are going to look into the abnormal increase of Vata Kapha Dosha there. But we need to remember the degree of coldness in the environment. In the sense, the 10 degrees Celsius minus 1 degree Celsius, they will be having the different type of the dosha prakopa, Vata prakopa in the body. 5 degree and minus 10 degree, so that will be having a different type of the Vata prakopa in the body. In that way, the degree of coldness will be determining the Vata dominance in the body. And number of ice creams. One ice cream, 3 ice creams, they will be having the different types of the Vata as well as Kapha Dosha Prakopa. Less number of the ice creams, less Vata Kapha Prakopa, more number of ice creams, more Vata Kapha Prakopa. In that way, we are going to expect the increase of Vata Kapha Dosha either in the skin, alimentary canal and airways. Whenever if you think about the second example, that is constipation and ice cream, that is Vegadharana and Shita Madhura Sevana. In that particular situation, whenever a person is doing the Vegadharana, that will be responsible for the Apanavata dysfunction, which in turn leads to Samanavata dysfunction, which in turn leads to Pranavata dysfunction, which is leading to the disturbed Ahara Parinamakara Bhava. That is Ushma, Vayu, Kleda, Sneha, Kala, they are going to get disturbed. And at that particular time, when the person is going to consume the ice cream, so that will be responsible for the increase of the Shitata in the alimentary canal. Thus, we are going to observe the Vata and Kapha Dosha abnormal increase in the alimentary canal. Third thing regarding the Vardhakya and ice cream. Whenever a person is having the Vardhakyata, so that will be responsible for the disturbed functions of all the body systems. For example, joint pain that may be observed, which may indicate the increase of Vata in the locomotor system or musculoskeletal system. The constipation, presence of that may indicate the DIT dysfunction. At that particular time, if the person is going to consume the ice cream, then there may be the possibility of increase of Shitata in the alimentary canal. As such, the person is having the constipation. Along with that, the person is going to consume the ice cream. There will be increase of Vata Kapha Dosha that will be observed in the alimentary canal. Ratri Jagarana and Madhura Rasa Sevana. Whenever Ratri Jagarana is being done, so that will be considered to be responsible for the increase of Ruksha Guna in the body. At that particular time, the consumption of ice cream that will lead to increase of the Shitata in the body. In that way, we are going to observe the increase of Vata can be attributable to Rukshata and increase of Shitata and Snigdhata, wherein the increase of Kapha Dosha specifically seen in the alimentary canal that may be observed in this particular example. Daytime sleep and samosa eating, Divaswapna and Katurasa Sevana. Increase of the Kapha will be observed when the person is doing the daytime sleeping, which is perceived by increased parasympathetic nervous stimulation. And at that particular time, if the person is going to consume the samosa, etc., which is having the potato and katurasa, etc., so that will be responsible for the increase of the Vata dosha in the body. So in total, when the person is doing the Divaswapna and is consuming the samosa, etc., there will be abnormal increase of Vata and Kapha dosha that is going to take place. With a lesser extent, Pitta dosha vitiation can also be observed. Shita ahara and Katurasa ahara. If the person is going to consume the Shita Guna Yukta substance as such, then that may be responsible for the increase of the Shitata in the body. That is increase of Kapha dosha and Vata dosha in the alimentary canal. And if the person is going to consume the Katurasa, that may be responsible for the increase of Vata dosha in the alimentary canal. In that way, if you are going to identify the Nidana as far as Vata Kapha Dosha vitiation are concerned, we have to identify the abnormal patterns. For that, you need to know about the timing of manifestation of symptom, Then we need to know about the chronology of the manifestation of the symptoms, and then we have to do the SNV analysis, source, number, and virulence of pathogen analysis has to be done. Then we have to identify the dosha vitiation, which has to be linked to the development of the symptoms. To sum up, whenever if you are going to do the analysis of any kind of the nidana, that too in case of the in this particular occasion, that is Vata Kapha dominant diseases, we have to know about SNV of pathogen entry into the body. S refers source of entry of the pathogens into the body. N refers to number of pathogens entering into the body. V refers to virulence of the pathogens entering into the body. Either any one, two, or more etiological factors related to Kapha Dosha Prakopa, and one, two, or more etiological factors related to Vata Prakopa exposures are seen simultaneously in an individual, which will lead to the manifestation of the diseases which may be having the Vata Kapha Dosha vitiation or Kapha Dosha as well as Vata Dosha vitiation. That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you would like to hear in the coming days in this particular channel? Mention in the comment box below, and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.